This is Talk Business and Politics with Roby Brock.
I'm Roby Brock. Welcome to today's Talk Business and Politics Daily. We will be joined today by Representative Lee Johnson, Republican of Greenwood. He is carrying a boatload of bills this legislative session, and a lot of them focus on health care. One in particular deals with higher education. We're going to talk to him a lot about health care and higher education on today's Talk Business and Politics Daily.
Talk Business and Politics Daily is sponsored in part by Impact Management Group and
Power. It's right there, waiting, ready to go when you are. Connect this, click that, unconnect and go every day. Delivered by your electric cooperative. Each unique, always united, and completely local. Born from a mission to provide dependable, sustainable, and affordable power to every corner of Arkansas. And delivering on that promise for a brighter Arkansas every day. It's the local hometown cooperative way. Better connected. It's together. The Electric Cooperatives of Arkansas.
Joining me now is Representative Lee Johnson, Republican of Greenwood. He serves on the House Public Health Committee. He serves on Insurance and Commerce Committee. He's the Vice Chair of Joint Budget Committee. And on top of all of that, he's a physician. So Representative Johnson, thanks for being here.
Oh, thanks for having me, Roby. Happy to visit.
And appreciate you taking a break from the 200 or 300 bills that you filed with legislative session to make time for us as well.
It's a good start. We're trying to make a difference down here.
Let's begin with what's happening with Medicaid. At the federal level, it is going to have some ramifications at the state level. We've seen the U.S. House of Representatives have passed a bill that cut $880 billion from Medicaid. We'll see if that happens over in the Senate. It's probably unlikely. But as a person that's planning budget and health policy, kind of what are the conversations? How are you guys planning to cope with what's happening at the federal level?
Sure. I think it's something that's on all of our minds. I mean, we certainly know there's the potential for federal cuts, and they would certainly impact our budget around Medicaid if that were to happen. But it's really, it's hard to predict exactly what will happen. I mean, to your point, is that really likely to pass? What will be the ultimate changes that we see? I think all of us are, making sure we're ready to react. Which is what we'll have to do. Whatever changes happen federally, we'll have to react to. And I think, we have shown a good history in the past of being able to react to changes. If changes happen, we'll figure out a way to land on our feet, I'm sure.
Are you having conversations with any members of the federal delegation to express to them what that impact might be? Or do you think it's pretty well known already and doesn't require a great deal of communication?
No, I think communication with our federal delegation is important, and I think those communications are happening. I think we've got, we're very fortunate to have a very strong federal delegation, both in the House and in the Senate. And, they are also very easy to get in touch with and good to provide feedback back to us as both citizens and representatives of the state. And then, making sure that they understand our concerns. That's never really been an issue for me with our federal delegation. They have always been very responsive and always good to listen to any thoughts I might have.
One last question on Medicaid expansion, on Medicaid, but about the Medicaid expansion program. That's a different formula in terms of the federal and state match on that. It's a 90-10 federal state match. If that's again another conversation that could happen. If the state is required to pick up more of a tab, do you think that Medicaid expansion folds in Arkansas? Does it cut back dramatically, or does the state find a way to basically pick up a bigger portion of that to keep those folks that are insured in those Medicaid expansion populations insured?
Sure. I think some of that depends on what cuts, if we see cuts, what they look like. I mean, if it's 85-15, that's different than 80-20, which is certainly different than 70-30, right? And so if we have to come up with a state share that's larger than the 10%, that's going to require some real discussion, at a budgetary level for what we can and can't afford. I think all of us appreciate the gravity of that decision either way. The healthcare system depends quite a lot on the expansion population as it is now. And so any changes that we see will, require quite a lot of reflection and input from a variety of stakeholders to make educated decisions. But how much we would be able to change or support really would depend on what those changes look like, if they happen.
I said last question on Medicaid. I'd lie.
No, that's okay.
One more
That's
question on
okay.
Medicaid
You know,
here.
I'm happy to visit. I always enjoy visiting.
Just what I mean, is there nervousness among the legislature about what's happening with Medicaid, or do you guys just kind of you can't control it, so you go along with the rest of your business? What's kind of the attitude in terms of dealing with this situation?
I don't think there's a lot of true anxiety around this right now. I mean, it's the middle of the session, and there's a lot of things going on, a lot of topics that people are interested in. I think there definitely is this sense that, hey, this is something that we can't really control as a body, and we are confident, I think, in our abilities to react to changes. And so I don't know that there's a tremendous amount of anxiety across the board, other than just to say it is something I think members are aware of. Members, pay attention to the news and conversations around this issue. And so I think there's a difference maybe between awareness and anxiety. I think awareness is probably the better adjective.
All right, Representative Johnson, I want to take a quick break here from Medicaid. I want to shift to some other healthcare bills that you are a big player in. We'll come back after the break.
Talk Business and Politics Daily is sponsored in part by Capital Advisors Group and
in the Navy, I train recruits. At Walmart, I recruit veterans. So many veterans have built their careers here.
Served in the Army for 11 years. I was promoted 4 times. Been with Walmart 9 years. I've been promoted 5 times.
I started as an hourly associate, and now I run the store.
430,000 veterans hired in the last decade. That's more than serving in the U.S. Navy today. There's no better place for veterans to work.
Connection. It's the heart of what we do. It's why we work to better the communities where we live and work. It's why we're expanding to get people connected and create digital equity programs that support affordable internet and digital literacy. We're leaders for positive change. From the way we empower our people, clients, and communities to the way we care for our planet. We live our values every day. We're Cox Communications, and we're pleased to connect with you.
We're here with Representative Lee Johnson, Republican of Greenwood. All right, let's shift gears and talk about some legislation that you have been pushing this session. Let's start with one that's already become law, and that is it was HB 1384. I think it's Act 196 now. It creates more medical residency slots across Arkansas. Do we need more than what this bill provides, and kind of what's the plan for how we get to where I think there is? We know what the needs are, and this bill moves us in the right direction, but probably doesn't get us where we want to get.
Yeah, I think there's going to be a growing need, right? We've seen the number of medical schools in our state go from 1 to 2 to 3, and now a 4th opening up in the fall in Alice Walton School of Medicine. And so that's great. I mean, we need a robust workforce around physicians in Arkansas, and the best way to create that workforce here in Arkansas is to grow it here in Arkansas. But part of growing the medical workforce is not just medical school, but the additional apprenticeship training we get after medical school that we call residencies. And these programs are where we finish the training for our medical students. And so as we've grown our medical schools, it's important that we keep pace with that growth with in-state residencies. And so are we where we want to be? No. Are we making significant strides? 100% we are. I mean, there's been some great efforts across the state to open more residency slots. And, the good news on a lot of that funding mechanism is there's, those programs have some upfront costs, but many times those programs over the course of 2 or 3, 4 years can become self-sustaining. So we're not at a point yet where we need to stop growth, but there hopefully is a point in the future where we grow to a place where some of these programs are self-sustainable.
You'll be proud to know that my daughter-in-law is in her final year of medical residency here in Little Rock, and she is going to be an OB/GYN, which we need more of in this state. So she's sticking around.
Desperately. Yeah, desperately. Glad she's going to be here. That's great.
All right, let's talk about another bill, kind of a non-controversial bill, I hope. 1398 is another bill that you sponsored. It's to require schools to have a cardiac response plan. It has passed the House already. It's down in the Senate. You got 97 votes in the House. I'm just hoping that those 3 that didn't vote for it were maybe absent that day.
Yeah, I think that's probably the case. This is a bill that came to me through the American Heart Association. And, we're actually a leader among states in how we approach cardiac arrest in schools. We have consistently been a policy forward a state in this arena. And this is another great policy that just, has our schools be prepared. There are over 300,000 cardiac events that occur annually outside of a hospital setting. And many of these can occur in a school-based setting, whether it's students or whether it's adults. Around 23,000 students will have some sort of cardiac event in the course of a year as well. And many of these events, if you are prepared in how to react, you can save a life. And that's with both CPR training, just sort of knowing what to do and who to call, and almost maybe even more importantly, these automated external defibrillators, these AEDs that you hear us talk about, knowing that they're in our schools, which we've already got them in our schools, just making sure that people know where are they located, how do you use them, and if someone collapses, what do we do? Because, this is one thing that you really can, with a pretty simple device, take someone who's not breathing, their heart's not beating effectively, and correct that with just a simple application of a device. And there's not a lot of opportunities like that in medicine. So, what this bill does is create basically heart attack drills for our kids, just the way we do tornado and fire drills. So I'm excited to have this through the House, and hopefully we can get it through the Senate.
Yeah, I think you'll be successful with that. All right, House Bill 1253 is the EMS Compact. I think you and Senator Justin Boyd are working on this bill collectively. It's a big bill. It's got a lot of text in it there. Can you just give me a 10,000-foot view of what exactly does this EMS Compact bill do?
Sure. We've seen a lot of compact type bills like this come through our legislative body last session and this session. And most of them, including this one, are designed to try to increase the flow of workforce across state borders. These compacts, exist among a group of states that get together and sort of have some agreed upon language around how we would license different professionals as a group of states. They all still maintain autonomy and authority of the states to ultimately decide who does and doesn't get a license, but they facilitate, workforce across different state lines. And all of the compacts that I've seen, are mainly driven towards workforce. This one is as well, but there's another component to this when we talk about EMS. Arkansas, all of the surrounding states right now are already participating in the CMS Compact, and there are times in our border cities, Fort Smith being one, where you might have an air ambulance flying to transport a person from Arkansas to Tulsa and maybe be asked to stop along the way in Oklahoma to save a life at a scene where there's a wreck. And if they're not cross-licensed, they're missing that opportunity to help someone. The same way with disaster management. Many times as a state where there are tornadoes in Arkansas or Oklahoma or flood in Louisiana, we share pre-hospital resources as states, and this facilitates the ability for us to both receive additional aid in the times of emergencies where we need, in disasters where we need more aid, and then also provide it across state lines in a more easy way. So not only for me is this one about workforce, this one's truly about clinical care and improving clinical care as well. So I am excited. It is a big bill, like you said, but this is all boilerplate language that is part of the compact itself. And so, this is language that everyone in the EMS community that I've talked to has read through and supported.
All right, lastly, let's talk about, you've got a career counseling bill. It basically kind of targets or aims people that have dropped out of high school or are in danger of dropping out of high school to kind of steer them into some technical fields. This is maybe a little departure from healthcare for you, but tell me what's the aim of this bill? I think it's House Bill 1601.
Yeah, that's one of my favorite bills I'm doing this session. It's not super transformative, but I think it calls attention to an issue that we need to try to connect with. Our approach as a state generally around career technical education, and it has been to try to attract high school students into the fields, which is great. Like there's definitely a subset of high school students who, want and need to learn a trade as opposed to maybe going to a traditional four-year institution. And we need trained workforce in the state, right? From an economic development standpoint, we need skilled labor. And it's great to try to connect with that group of kids. And I support all the efforts we make to connect with kids 7th through 12th in that space. But there, is another subset of young adults out there who've gone to college, maybe even incurred some debt, and it's just not working out for them. When you look across the nation at how four-year institutions measure success, they measure it in graduation rates over 6 years. And the national average is 65%. So 35% of students who start in a four-year institution will not graduate within 6 years. And 40% of those students will drop out with some form of school debt. And so this is a group of young adults who maybe have a different level of maturity than you do when you're 16, 17, and 18. I think sometimes at 16, 17, it's maybe hard to look out there and not see that, hey, maybe I don't need the college experience. But for a 21-year-old who's got a grade point of 1.0, who's at risk of dropping out of college and maybe has $10,000, $15,000 in school debt, that's a motivated individual that's looking to connect with workforce resources. So what this bill does is it requires our four-year institutions and our Department of Higher Ed to connect these young adults with workforce resources around career technical training and trade schools. And hopefully, my hope is this is a starting point to sort of grow awareness around this group of individuals with industries around the state that are looking to connect with workforce in this space.
All right. He's Representative Lee Johnson, Republican of Greenwood. Thank you for your time. Thanks for all the heavy lifting you're doing this session as well.
Thank you, Roby. I appreciate being on. Thank you much.
And that is all for this edition of Talk Business and Politics Daily. Thanks for tuning in.